the aesthetic inlay and gold onlay. The terms inlay and onlay will be used interchangeably. The definition of when an inlay technically becomes an onlay depends on the reference. A direct restoration is placed directly into the cavity preparation chairside. The material then hardens within a retentive preparation and the restoration is completed with shaping and polishing. An indirect restoration is made outside of the mouth and then cemented to the prepared tooth. Typically this requires at least 2 appointments. There is at least one method that allows for a single appointment indirect restoration, but the restoration is still fabricated outside of the mouth. So we have direct and indirect restorations. There's another way to classify restorations: intracoronal and extracoronal. Intra means inside. Extra means outside. So, we have restorations that are more or less within or inside the crown of the tooth, and then those restorations that cover the outside of the tooth. Intracoronal restorations are the operative preparations, such as the class 1 through 5. Veneers and crowns are extracoronal, since they cover the outside rather than being down in the internal aspect of the tooth. Other terms to know from this lecture are flare, vent, and draw. These will be defined and described throughout the lecture. Typical materials used to fabricate indirect restorations are gold, composite and various ceramics. Ceramic and composite are both tooth-colored materials. Since ceramics tend to last much longer than indirect resins, ceramics tend to be used more often. Gold inlays and onlays were used extensively until about 1980. There are times when gold is the material of choice. The gold preparation has a few more requirements than the aesthetic inlay preparation, so we will discuss the gold preparation in detail and note the features, which differ for ceramic or resin. Inlay. An indirect intracoronal restoration. Onlay. An indirect restoration that restores one or more cusps and the adjoining occlusal surfaces or the entire occlusal surface. When do we use an indirect restoration? We consider the size of the restoration and the amount of remaining tooth structure. Large restorations are very dependent on the strength of the restorative material. CAD CAM ceramics and gold have that necessary strength. Another issue with large restorations can be obtaining contours with direct restorations. With indirect, the contours and contacts are controlled during fabrication. The length of service of indirect restorations is generally superior to that of amalgam or direct composite. Other deciding factors include the time and cost for an inlay or onlay. The cost of the materials and fabrication are higher than the cost of amalgam or composite. Laboratory costs contribute to the overall cost, and vary depending on the restoration. The procedure requires at least 2 appointments. This also contributes to the cost, as it's twice the amount of infection control items and such. Also consider the patient's situation. If the patient is leaving the country the next day, then an onlay may not be the best treatment at that point in time. This is possibly the most extreme example, but these situations do arise and need to be considered. What else do we consider when determining if this is the right restoration for the patient? Oral hygiene, caries rate and age of the patient tend to go hand in hand. A young patient may have poor oral hygiene. Any patient with poor oral hygiene tends to have a high caries rate. How do you think the poor caries rate enters into the decision? A patient with a high caries rate and a high caries risk will be needing a replacement restoration long before he or she would need a replacement restoration if they had a low risk for caries. So, for economics' sake, if the patient needs restorations every 6 months, I would select the amalgam restoration. Otherwise the patient buys the gold, it is fabricated and cemented, then recurrent caries necessitates its replacement. So then, we cut it out and replace it. That's doubling the cost to someone. Insurance has a time frame, where they'll not cover the replacement of an indirect restoration. So how long can an inlay or onlay last? There are gold onlays that have been in service for over 50 years. A more common length of time is 20 to 30 years. So they far outlive an amalgam, which tends to last 15 to 20 years. CAD CAM ceramic materials are expected to be as good. Without having CAD CAM for 50 years yet, we don't have this knowledge yet. One more note on the longevity of any restoration. The longevity is dependent upon the restoration, and how well it was executed, and the longevity depends upon the patient, oral hygiene, diet, saliva. Those factors which contribute to caries risk. All of the factors we just talked about point towards an inlay. However, we haven't talked about the tooth itself. If fracture lines are noted on the tooth to be restored, a crown is more likely the restoration to select. Likewise, if class 5 caries exists on the facial or the lingual, a crown is typically best. Why do an indirect restoration to restore the MOD defect, and then restore the class 5 with composite or amalgam? A crown covers all surfaces of the tooth, so a crown is typically best if either a class 5 lesion or previous restoration exists. And, what is CAD CAM? It is a method of obtaining an optical impression. The impression is a digital image of the prepared tooth. And then the computer is used to help design and cut the restoration out of a solid block of restorative material. The drawings in yellow on the left depict various outlines, which can be machined by the computer systems. The 6 drawings on the right are of the computer monitor of a CAD CAM system. The system allows the operator to make a digital impression of the preparation and create a virtual restoration. Seen in the bottom row of pictures. The inlay preparation is sometimes used for a type of bridge, which is bonded to the retainers. Typical bridges will encompass the entire adjacent tooth with a crown. However, there is an occasional need for a bridge of this type. The resin inlay bridge can be considered when the adjacent teeth have minimal or no caries or restorations, when the occlusion is not heavy, and when the teeth do not have short clinical crowns. The amount of divergence has a name. This is the vent. To remember its name, think of the letter V. In cross-section, the vent is V-shaped and the word vent begins with the letter V. When divergence is excessive, the prep is said to have excessive vent. Or perhaps only one wall has excessive vent. Likewise, a wall needing more divergence would thus be said to need more vent. Another term which closely follows vent is the path of insertion. The path of insertion is that pathway which the restoration will follow, when it is either being placed in the mouth or tooth, or when it is being removed. The inlay for the drawing would have to follow the blue arrow, to be inserted or removed. As with other preparations, the head of the handpiece should be held parallel to the occlusal table of the tooth being prepared, so that the burr is then parallel to the long axis of the tooth or perpendicular to the occlusal table. When this is accomplished for indirect preparations, the path of insertion will then be parallel to the long axis of the tooth. The concept of vent leads us to the draw of the preparation. For a solid piece of material to fit down into the preparation, there must be no undercuts. All vertical walls must be able to be seen at one time. The green dots represent areas at the junction of the walls and the floor. These line and point angles must be visible. When viewing this, checking for draw, we use our dominant eye. When checking for draw, if we view the preparation with both eyes, we will not get a true reading. So, we close our non-dominant eye. There are several ways to determine your dominant eye. For the hunters in the class, you probably already know which eye to use for most accurate line of sight. The simplest method is, whichever eye you bring the camera to when making a picture, or use with a telescope or microscope, that is most likely your dominant eye. The figure These two websites describe further what eye dominance means and many ways of verifying your dominant eye. This method is found in an archery webpage. Let's do this one together. First, hold your hands out in front of you. Form a triangle with your hands like in the picture. For this to work, you need to be sure the triangular space is fairly small, smaller than an inch. Now, look through this triangular space at an object that is off in the distance. Keep both eyes open. As you look at this object, move your hands slowly toward your face. Keep looking at the object while moving your hands slowly. When your hands touch your face, the triangle opening should be in front of your dominant eye. If you move your hands fast, or if your triangular space is too big, you may find that your triangle ends up on your nose. Try again, being sure to move slower and to keep the space small, and to select an object at least 10 feet away or more. Choose something on the opposite side of the room. The bench lights make a good object to sight. Just choose one several benches away.